Hello everyone, welcome to our Science Tech YouTube channel. I am Pallavi Kantamneni. Hope you all doing well. So, today in our Science Tech YouTube channel, I am going to deal with the systems in the human body. So, our human body contains 11 types of systems. They are cardiovascular system, respiratory system, nervous system, and skin which is an integumentary system, lymphatic system, skeletal system, muscular system, endocrine system, digestive system, urinary system, and reproductive system. So coming to the cardiovascular system main action is to pump and circulate the blood throughout the body. The heart and blood vessels are the part of the system. Coming to the respiratory system adds oxygen to the blood and removes carbon dioxide when we breathe in and when we breathe out. The nose, mouth, pharynx, larynx, trachea, bronchi and lungs are the part of the system. Okay, then coming to the nervous system control how the body interacts with and responds to the environment. The brain, spinal cord and sensory organs are the part of the system. Coming to the skin, which is an integumentary system, the skin protects the body from the external environment. The skin and the underlying connective tissues, glands, fat and blood vessels are the part of the system. Coming to the lymphatic system helps with immunity, blood pressure regulation and digestion. The lymphatic system also helps create and circulate white blood cells and antibodies. Coming to the skeletal system mainly deals with the bones and cartilages. Here the skull, vertebral column, sternum, ribcage and limbs are the part of the system. Coming to the muscular system mainly deals with the muscles which are derived from the mesoderm. Coming to the endocrine system deals with all the glands and the hormones of the body. Coming to the digestive system deals with the process of digestion in the body. In the mouth, esophagus, stomach, small intestine, large intestine, liver, pancreas are the parts of the system. Coming to the urinary system mainly deals with the diseases of male and female urinary tract. Here kidneys, ureters, bladder, urethra, penis, testis, scrotum, etc. are the parts of the system. Reproductive system. Coming to reproductive system mainly deals with the male and female reproductive organs in the human body. Okay, clear? Then today we will deal with one of the systems in our human body. Today we will deal with pulmonology. Pulmonology, which is also called as respiratory system. Here pulmonology, that is a medical study of structure and diseases of respiratory system from nose to lungs. Okay. Coming to the introduction part, pulmonology is the medical study of the structure and diseases of the respiratory system. These includes all of air passages from nose to tiny air sacs in the lungs. Okay. Then the lungs are the vital to our existence because they extract oxygen from atmosphere, transferring oxygen to blood vessels, then they carry throughout our bodies. Without a steady supply of oxygen, we can survive only for a few minutes. A pulmonologist is a physician who specializes in the diagnosis and treatment of diseases and conditions related to the respiratory system. Okay, clear? Then coming to the structure of the respiratory system. Here the upper part of respiratory system including the nasal and oral cavities, pharynx and larynx. So respiratory system is mainly of two parts, upper respiratory tract and lower respiratory tract. Here upper respiratory tract includes nasal and oral cavities, pharynx and larynx. So in this chapter we will deal with the lungs and those structures associated with them. Okay. Then see the figure here. The trachea and the windpipe extends from lower part of the larynx to the bronchi and contains 16 to 20 pieces of C-shaped cartilage that provides its rigidity. See the picture here. This is the lower part of the larynx. So it starts here and contains 16 to 20 pieces of C-shaped cartilages. These C-shaped cartilages provides the rigidity. Okay, clear? Then the lungs are the primary organs. See these two. Okay, right lung and left lung. Okay, the lungs are the primary organs of the respiration and are positioned on either sides of the thorax. Okay, clear? Then they are protected by the ribs and sternum. Sternum is a breastbone. Okay. Then see this picture here. This is the part of the parts of the respiratory system. First the nasal cavity, pharynx. Here this is the pharynx. Here this is the larynx, and this part is an epiglottis. And see here this is the trachea, bronchi. This is the left lung. Okay, and this is the right lung. This here the diaphragm. This diaphragm is for contraction and relaxation while we breathe in and breathe out. Okay, clear. Then coming to this slide. Then the thoracic vertebrae are posterior to the lungs. Okay, the medial space between the two lungs is called mediastinum. See here, these are the two lungs. This is the space between the two lungs. This space is called as mediastinum. Okay, and it contains the heart and thoracic viscera, except for the lungs. Because the heart is inclined to the left in the mediastinum, the right lung is slightly larger than the left. In the left lung, the heart is inclined to the position in the mediastinum. So right lung is slightly appears larger than the left. Okay, clear. Then series. Each lungs are divided into sections called lobes. The left lung has 2 lobes, while the right lung has 3 lobes. These are mainly of 5 lobes. See the picture here. Each lung has an oblique major fissure. See, each lung has, both lungs has oblique fissure. Okay. Then in addition, the right lung has horizontal fissure. See, in left lung and right lung, we both have oblique fissures. These both have oblique fissures. But in the right lung, additionally, they contain horizontal fissures. And superior lobe and middle lobe, in which these are all common. Okay. Okay, coming to the slide. The right and left bronchi extend from the trachea to the lungs. From the trachea to the lungs, the bronchi gets extended. Once the bronchi enter the lungs, they divide into smaller and smaller branches, creating the appearance of an upside down tree with the trachea being its trunk. In fact, this structure is referred to as the tracheobronchial tree. See this picture. This appears like an upside down tree. This upside down tree is also called as tracheobronchial tree. The smallest branches are called bronchioles. See, these are the smallest branches of bronchioles. Okay guys, clear? These are called bronchioles. Coming to the next slide. At the end of the bronchioles, the tiny air sacs called alveoli. Okay, networks of tiny blood vessels called as capillaries surrounding these alveoli. These capillary beds obtain oxygen from the alveoli and in return transfer of carbon dioxide to the alveoli. So, as I said, they have capillary beds. These capillary beds obtain oxygen from alveoli. While they are obtaining oxygen from alveoli, they have to return carbon dioxide to the alveoli. In return, they send carbon dioxide to the alveoli. It is this exchange of oxygen for carbon dioxide that allows our bodies to obtain oxygen needed for survival and to get rid of carbon dioxide as a waste product. So, when we take, while the exchange is going on, our body takes oxygen for our survival and get rid of carbon dioxide as a waste product while we exhale. Okay, clear? Then coming to the next slide, each lung is contained within its own pleural sac that is formed from a serous membrane called pleura. From the pleura, pleural sac is formed. So the visceral pleura lines the outer surface of each lung. See here, this is the outer surface of this is a lung. This is the outer surface of each lung. So this is a visceral pleura. The parietal pleura lines the outer wall of the pleural cavity and separates the ribcage and superior surface of diaphragm from the pleural cavity. See the parietal pleura. This is the parietal pleura. This lines the outer wall of pleural cavity and it separates the ribcage and superior surface of diaphragm from pleural cavity. Between these two pleura, the pleural cavity is created. It is a space lubricated by pleural fluid, allowing the lungs to move freely within the ribcage during breathing. See, this is the pleural cavity. Between these visceral pleura and parietal pleura, we have pleural cavity. So, this pleural cavity allows the lungs to move freely within the ribcage during breathing. Okay, clear guys? Okay, coming to the next slide. This is the picture of our inhalation and exhalation process. See this process. The process of moving air in and out of the lungs is referred to as breathing or ventilation. Okay, clear? During breathing, Air enters the body through either the mouth or nose. While we inhale the air, air enters to the body through either nose or mouth. Air then passes into the pharynx through the trachea and into tracheobronchial tree. So, while we inhale, the air enters into our body through nose or mouth. It enters into pharynx through trachea and into the tracheobronchial tree. Normally, in human body, per minute, breathing occurs only about 4 to 20 times per a minute. In addition, we can control our breathing while necessary, such as during swimming also. Okay, clear? Then this is the exhalation process. Okay, coming to the next slide. Breathing consists of two distinct phases, inspiratory phase and another one is an expiratory phase. During inspiration, the diaphragm, a large musculomembranous structure between the thoracic and abdominal cavities, contracts. Here, while we inhale, the diaphragm contracts and pushes the abdominal cavity downward and allowing the muscles in the thorax to expand. Okay, here clear that while during inspiration, the diaphragm contracts. When the inspiratory phases stop, the lungs and chest wall relax and the diaphragm slowly rises. While the inspiratory phase is going to stop, the lungs and chest wall get relaxed and so then the diaphragm slowly rises. Here then the expiratory phase starts. Okay, clear guys. Then coming to the next slide, the second phase starts. The second phase is called as expiration phase or also called as exhaling. When the lungs exhale, the diaphragm relaxes. When the lungs inhale, the diaphragm contracts. When here the lungs exhale, so the diaphragm relaxes and the volume of thoracic cavity decreases while the pressure within it is increases. While the thoracic cavity volume decreases, pressure will be increased. Okay, clear here. Volume decreases, pressure increases. As a result, the lungs contract and air is forced out. That is called exhalation. Clear? Okay, coming to the next slide. Respiration can be divided into two processes, external process and external respiration and internal respiration. During external respiration, oxygen and carbon dioxide are exchanged between the person and the air in the environment. Okay, during external respiration, so what do you mean by external respiration? The air which we breathe from surround outer surface from the atmosphere. So here the exchange between the person and the air will be done. That is called as external respiration. During inhalation, the diaphragm contracts and the chest wall expands, so air flows inside the body. That is an inhalation. So coming to the next slide, internal respiration refers to exchange of oxygen and carbon dioxide at the cellular level. So uh, during external respiration, the exchange between person and the air in the environment is done. But in the internal respiration, the exchange of oxygen and carbon dioxide at cellular level will be done. So that the body uses oxygen and releases carbon dioxide while inhaling as a waste product. Okay, see the picture here. It is an alveolus gas exchange. See here alveoli. Then oxygen. Oxygen is entering into body as an air. So capillaries, carbon dioxide out, oxygen in, red blood cells and alveolar valve. So all the process will be done in these cells in our body itself and then sends carbon dioxide as a waste product. So during exhalation, okay, clear? Then transportation of gases. See this picture. So this is quite alternate to itself, while the red blood cells at tissue capillaries and red blood cells at lung capillary. See here. See these two pictures, okay? Coming to the next slide. Coming to the pathology of pulmonology, respiratory system. Pathology. See, pathology. Pulmonary diseases. Pathology is nothing but the diseases which we get from the diseases of respiratory system. So ADRs, I think all of you are aware about ADRS. So what do you mean by ADRS? Adult respiratory distress syndrome. Okay, in this acute respiratory failure that appears following pulmonary injury such as direct chest traumas, sepsis or inhalation of toxic gas. So okay, clear? Anoxia. Anoxia is complete or nearly complete absence of oxygen from the blood. Anthracosis. It is a type of lung disease caused by a long-term inhalation of coal dust. Okay, going on inhaling from so many years ago, inhaling the coal dust. So this anthracosis will be occurred during coal mining. A type of pneumoconiosis, also called as coal worker pneumoconiosis or black lung disease. Anthracosis is also called as black lung disease. Okay, coming to next, asbestosis. Asbestosis is a type of lung disease caused by the long-term inhalation of asbestos dust. It is a type of pneumoconiosis. Okay, asphyxia, an inadequate exchange of oxygen and carbon dioxide. Okay, clear. Then chronic bronchitis. Bronchitis that lasts at least 3 months. It can be a symptom of lung cancer, tuberculosis, or chronic heart failure. Then again COPD. Uh, okay, I think you all are aware of COPD. This is nothing but chronic obstructive pulmonary disease. Here see, remember it is a chronic disease. Chronic means long-term disease. A general term used for diseases that cause the bronchi to be either permanently or temporarily narrowed. Clubbing of fingers. A physical finding in which the ends of fingers are enlarged, round and bulbous. The angle of nail bed also changes. It can be a sign of several conditions including chronic hypoxia and lung cancer. Okay, we may see that our fingers, at the tip of our fingers are enlarged, round and bulbous. This condition is nothing but clubbing of fingers. Okay, cough. I think you all are aware of cough. All of you know about cough. Okay, then crackles. Crackles are nothing but abnormal breath sounds heard and auscultation of chest that are brief, sharp, and non-musical. Then coming to croup, any acute respiratory condition in children and infants that is characterized by rough breathing and a hoarse cough. Coming to cyanosis, it is very important. Cyanosis, a bluish or purplish discoloration of skin and mucous membranes due to inadequate oxygenation of blood cells. If a person is suffering from cyanosis, you can easily identify that the discoloration of skin to blue or purple color, then the person is suffering with cyanosis. Okay, clear here. Okay, then agophony, a term used to describe an abnormal vocal sound similar to the bleating of goat. Oh, okay, then emphysema. Emphysema is nothing but abnormal and permanent enlargement of alveoli with the destruction of alveolar walls, characterized by the use of accessory muscles for breathing and pursed lips. Emphysema is that nothing but pus in body cavities. This term is most commonly used to refer the pus in pleural cavity also. Pyothorax. Hemoptysis, the act of spitting blood. Hyaline membrane disease, a condition in premature newborns caused by deficient pulmonary surfactant, the substance required for the lungs to expand, leading to respiratory distress, also called as respiratory distress syndrome. Okay, hypercapnia, an abnormally excessive amount of carbon dioxide in the atrial blood. Hyperipnea, rapid deep breathing that can be brought on by exertion, anxiety, or certain abnormal medical conditions. Okay, clear. Then pneumonia. Pneumonia is the most important condition in total pulmonology. Okay, then coming to pneumonia, an acute inflammation of the lung tissue, including the air spaces within the alveoli. The alveoli typically fill with the pus and other materials as a result of inflammation. Pneumonia can be caused by inhalation of chemicals, trauma, or bacterial, viral, and fungal infections. Mainly see pneumonia is very common. Okay, pneumonoxil, the protrusion of a portion of the lung through an opening in the chest wall, also referred to as pleurosil or pneumocil. Pneumothorax, the presence of air or gas in pleural cavity. When we see the gas or air in the pleural cavity, then it is as the pneumothorax. Pulmonary abscesses, a collection of pus in the lungs and as an end product of the destruction of lung tissue. Okay, clear? Then coming to the procedures. Procedures are nothing but how the doctor deals with our disease. Okay, how the provider deals with our disease, how they can treat, how what are the ways to treat these pulmonary disorders. Okay, coming to the procedures, bronchoscopy is one of the method. Bronchoscopy is nothing but an endoscope is inserted through the nose or mouth. Endoscope, endoscope. That endoscope which is to be inserted through nose or mouth, passed through the trachea and into the lungs. That endoscope is passed into the lungs, allowing for visual examination of the tracheobronchial tree to see how the tracheobronchial tree is working in our lungs. The bronchoscopy is done. Lung secretions and or tissues may also be collected for laboratory analysis. Okay, clear? Then chest radiography is also another type of procedure. Images of chest are recorded for diagnostic purposes using X-rays. I think you are all aware of X-rays. Okay, you know is X-rays. Okay, then CT scans. CT scan of chest. A computer-generated reconstruction of chest is created from a series of X-ray images taken as cross-sections of the chest. These procedures are done with providers as doctors to know what is the cause of our diseases. Okay, clear then. Sweat test, thoracentesis, thoracoscopy are also the another type of procedures. Okay, clear. Then pulmonary function test. Pulmonary function test is also a type of procedure. So pulmonary function tests are widely administered to determine the capability and capacity of respiratory system. This pulmonary function test, PFT is mainly done to determine the capability of our respiratory system and how lung capacity, and to know the lung capacity. Static measurements such as volumes and dynamic measurements such as flows provide clues as to the quality of ventilation, gas exchange and lung mechanisms. Spirometry is a measurement method that uses an instrument called spirometer to measure the amount of air and the rate of its movement into or out of the lung over a period of time. The results of these tests are specified in pulmonary respiratory terminology. This terminology and the corresponding abbreviations are shown in next coming table. Note that the second column of this table shows how each abbreviation should be transcribed. So, when we done all these PFT tests, or not only PFT, any test to identify the main cause, we directly provided doesn't give the terms. So our test contains some abbreviations, that CT scan test, X-rays, whatever it may be. They contain the short forms. So we should be aware of the short forms. So coming to abbreviations, A and P. So what do you mean by A and P? That is auscultation and percussion. ABG. So in our which we are getting tested, they didn't get we didn't get full names of our diseases. So like ADRs, the person is suffering from ADRs. What do you mean by ADRs? So that is adult respiratory distress syndrome. Like that, BAL, bronchoalveolar lavage, BOOP, bronchiolitis obliterans with organizing pneumonia. CO is carbon monoxide. Okay, clear? Then this CO2, carbon dioxide, COLD code, chronic obstructive lung disease, COPD, chronic obstructive pulmonary disease, CPR. See, like this we will get in those tests. CPR, cardiopulmonary resuscitation, CXR, chest X-ray, DNR, do not resuscitate, HMD, hyaline membrane diseases, IPPB, intermittent positive pressure breathing, IRDS, infant respiratory distress syndrome, PA, posterior and anterior, PCP, pneumocystis cardiac pneumonia, pulmonary embolism, PFT, pulmonary function test. See this. Okay, now I think so you got it. PFT, pulmonary function test. RD, respiratory diseases. RDS, respiratory distress syndrome. SOB, shortness of breath. TB, tuberculosis. Okay. Okay, thank you. I think at the end of this PPT, you are aware of pulmonology. Is that you should know the structure and types of respiratory systems, what are the lobes, what are trachea, what is the bronchioles, what are the bronchi, all of this. What are the types of pleura, the passageway and the phases of respiration, respiration processes, respiration process like you should be aware of this, and pathology, procedures, abbreviations, all of this. Okay, I hope you got it. Thank you guys. Please like, share and subscribe for more videos. Thank you.